right, welcome everyone. My name is Bree Kimberline. I am a community health coordinator here at North Kansas City Hospital. I would like to introduce you all to Stephanie Ramirez. She is a speech language pathologist and she knows all things brain. She is the brain lady. So she's actually doing a 3-part series. This is the second in the series called Importance and Approach for Early Diagnosis of Alzheimer's Dementia. Our next presentation will be September 14th. So if you're looking to get a little more info from her, she is a great speaker. I would highly recommend you guys tune in for the September 14th offering, which is music. It's a total brain workout. So I'm going to turn it over. Take it away, lady.
Great. Thank you so much. And I'm so excited to be presenting. This topic is very near and dear to my heart. Also, just because there are so many amazing new discoveries and advancements in the area of diagnosing Alzheimer's and dementia. So I'm really excited to share that with you today. So just a little background, I am a speech language pathologist. I've been practicing for about 12 years. I started out working in skilled nursing facilities where a lot of my patients were diagnosed with some kind of Alzheimer's or dementia. And then for the past 7 years or so, I've been full-time in the hospital setting, so seeing patients in the hospital and as outpatients as well. I am a community educator for the Alzheimer's Association Heart of America chapter, and I have been the MC for the Walk to End Alzheimer's and Liberty for the past couple of years, which has been very fun. We do have a walk coming up in October, so you can check that out online. And just to kind of give you a little bit of the personal story, so in 2019, I actually lost both of my paternal grandparents to Alzheimer's. So my grandfather had had the diagnosis for several years. My grandmother had had the diagnosis for about 3 months. So it was a very different presentation in both of them, and they both passed away within about 6 months of one another. But it just kind of gives me, I think, that passion to kind of spread awareness and share their story, because I think if it could help anyone else, that is my goal. So when Edward Jones did a study recently about what retirees were most worried about later in life, and this is fairly recent, this is post-COVID-19, Alzheimer's and dementia rated as the top fear for retirees. And I think that's because there's a lot of stigma around it. There's a lot of unknowns. And ultimately, up until recently, it's a disease that we really had nothing medical-wise, pharmaceutical-wise to help with the actual disease process. So hopefully by giving some education and empowering people, we can make this number go down and make it something that doesn't seem so scary, so daunting for people. So to start out, I kind of like to give a little caveat. Alzheimer's versus dementia. A lot of times those are used interchangeably, but they are different. So dementia is the general term for memory, language, problem solving, and other thinking abilities that have deteriorated enough to interfere with your daily life. So it's kind of the umbrella term, if you will. Alzheimer's disease is a type of dementia. It is the most common type, and it accounts for about 50 to 75% of disease diagnoses. Other kinds of dementia that you might hear are dementia with Lewy bodies, frontotemporal dementia, vascular dementia. But again, Alzheimer's is the most prevalent, and it is just one type of dementia, which is the umbrella term. So when you're getting an Alzheimer's diagnosis, that's kind of where that's coming from. So talking about our goal for today, some questions that I hope to answer for you. Number one, when should someone seek out an evaluation? Number two, what does that diagnosis process look like? Number three, why is it important to get an early diagnosis? And number four, I think the question that I get from most of my patients is what comes next? So hopefully by the time we're done today, you will have the answers to these questions and we can get you feeling a little bit more confident in your ability to face this disease head on. So when to seek an evaluation, the earlier the better. I think that this is the case because of a lot of things. Most people come to me and they're worried about things going on that they're noticing, but there are normal age-related changes in our memory and thinking. So I just want to give maybe some people a little bit of encouragement that what you're experiencing could be very normal. So before you go seeking a diagnosis, things that are completely normal, forgetting what day it is, but remembering later, losing things, but being able to retrace your steps to be able to find them. Sometimes forgetting what word to use or having that feeling like a word is on the tip of your tongue. Usually it can come back later. Missing a monthly payment occasionally, like, oops, I forgot to pay that bill this month. Making a bad decision occasionally. We all do that. We're all human. A slower processing speed, that is quite normal as we age. More difficulty with multitasking. So all of these are very normal, but when we think about where the line is from what's normal versus what we should be concerned about, a lot of my patients tell me Alzheimer's is a different kind of forgetting. You know, it's forgetting what day it is, but not being able to remember later, or maybe even forgetting what year it is. It's forgetting someone's name that you've known for a long time and not being able to come up with it. So what are those warning signs that might tell you, hey, I think it's time to start looking into this deeper? And number one, memory loss that disrupts daily life. So maybe you have a loved one or even yourself, you feel like you're forgetting events, conversations completely. You have no idea that you had that conversation. It's not coming back to you. Maybe you need frequent reminders about routine events or information. So with my grandfather, you know, he helped in the bingo hall with Rotary every week, and then he started forgetting about that. And it was something he had done for a long time. Maybe they're repeating the same information or the same questions again and again, and it's becoming really disruptive. Challenges in planning or problem solving. So again, difficulty with routine tasks, things that they've been doing for a long time, but then all of a sudden they're not able to do it anymore. Maybe following a recipe, keeping track of appointments, maybe difficulty following a storyline on TV or a book, difficulty focusing or concentration. And to kind of piggyback on that, difficulty completing familiar tasks. So difficulty driving, difficulty using the phone or shopping, difficulty with household chores. My grandmother had a really hard time managing her medications, which she had been doing on her own for quite a while. So that was another red flag for us. Confusion with time or place. So losing track of days, weeks, months, losing track of when something happened. Getting lost on a familiar route while in the car or while walking, those are all red flags. Trouble understanding visual images and spatial relationships. So maybe they have difficulty with balance. You're noticing they might be falling or tripping over things. Maybe they're spilling things because they're reaching for their glass and they're not quite grabbing it in the right spot. New problems with words, which can be in speaking or in writing. So maybe they forget about conversations, but they also forget common words or familiar names. My grandmother would often call me my aunt's name because that was more familiar to her, even though, you know, I was 30 years old. You know, she had known my aunt for a lot longer than me, so she would call me my aunt's name. Maybe forgetting or difficulty following verbal directions. So having trouble, you know, following directions, needing things written down. And maybe you notice like when they're paying bills, they have difficulty signing their name or writing checks. That can be a red flag. Misplacing things or losing the ability to retrace your steps to find them. So it's not just, oh, I can't find the remote. Oh, it fell down in the couch cushions. It's I can't find the remote. Oh my gosh, we found it in the refrigerator. It's in a completely off the wall location. You would not, necessarily know that it was there. And not having an awareness of, yeah, oh yeah, I went over to the refrigerator and I had the remote in my hand. I might have put it in there. No awareness or ability to recall that. You might see decreased or poor judgment. So unfortunately, this population is a lot more likely to be a victim of different scams. They might make more impulsive or poor financial decisions. They might have difficulty caring for pets. And you might notice that they have poor ability to care for themselves. Maybe you notice like somebody who is normally very well put together starts to look a little bit more unkempt, and they're just not doing that personal hygiene like they used to. Withdrawal from work or social activities. A lot of times people stop doing the things that they normally do. So maybe they don't go to church or other activities. Maybe they stop watching sports games on TV. They're losing interest in those hobbies or things that they normally really enjoyed. And maybe they're just sleeping more throughout the day. They're just not as active. And then finally, changes in mood or personality. So being more fearful or suspicious of other people, being more easily upset. Sometimes you might notice these behavioral changes happening closer to bedtime, and we a lot of times will refer to that as sundowning. So if it happens later in the evening, you might notice that their behavior is worse. So, if you are noticing of those 10 warning signs, and I did do a talk that talks about each of those in a little bit more detail, and you can find that on the North Kansas City Hospital YouTube page if you're interested in more details there. But if you're noticing one or more of those signs, what do we do next? I think number one, you have to start a conversation, and it's a conversation that nobody necessarily wants to have, but it's very important to have. Because ultimately, and I tell this to all of my patients, it comes down to safety. We want to make sure that you're safe. We want to make sure that everyone around you is safe. And it's better and easier to have those conversations earlier in the process when the person is more aware of what's going on potentially. So you might sit them down and discuss, these are the things that I have observed. These are the concerns that I have. And really establish that support. I am here for you. We are in this together. I want to help you. Try to be more supportive, less accusatory, because I think it's going to be natural for someone to get kind of defensive. I mean, these are all pretty sensitive areas. And when we think about someone who's cared for themselves and probably raised a family and worked their whole life, realizing that some of the things they used to do without even thinking about it are more difficult, that can be really hard. And I think making a plan, what are we going to do next? And we're going to talk more about that together so you know what your plan should be. And then finally, learning more together. Alzheimer's Association, alz.org, their website has an amazing amount of information on all kinds of things Alzheimer's related for patients and families. So I would highly recommend you check that out. They have a 24/7 helpline that you can call at any time of day if you have a question or a concern and you want some professional advice. So there are resources out there, and I think that knowledge is power. The more that we understand about something and the more that we know, the more that we can know what to do about it. So after you've had the conversation, it's really important to make an appointment to see your doctor. And typically it starts with the primary care provider, so your family doctor. I think it's always a really good idea to have somebody else there for support. So it's not just the person who has those red flags going in by themselves. Somebody's going in there not only for support, but to be able to take notes, ask questions, follow up so that you can then communicate with the other people that are involved in that person's life. It's always a good idea to bring a list of current medications and supplements and write down your questions before you get there. because I think sometimes it can be really overwhelming. I know when I go to the doctor, sometimes I forget questions that I wanted to ask because I get so distracted by everything else that's going on in there. So writing down your questions so that you can make sure that you leave knowing that you had those answered and that you know what's going to be happening next. So you've made the appointment, you've prepared for the appointment. Now it's time to go in. And what's that going to look like? And it's a little bit different for everybody, but I will walk you through kind of the typical process that it takes to get an Alzheimer's diagnosis. And I will just say, when I first started 12 years ago, even, Alzheimer's disease was something that could only be diagnosed after a person had passed away, when they could actually look at the brain and see the signs of Alzheimer's. It was not something that people ever got when they were alive. And then now it's something that is very commonly diagnosed. And it's something that, you know, we can use these tools that we're going to go over to give someone a diagnosis when before that wasn't even an option. So just getting a diagnosis is a huge step in the field of Alzheimer's research, and I think leads to much better patient outcomes. So in that initial appointment, your doctor will be answering your questions. They will most likely go through a very thorough medical history and physical exam. They may order tests. Now, you might not get all of it, but you might get some components of these: a brain scan, which might be a CT scan or an MRI, blood work, urine analysis, and sometimes they do cerebrospinal fluid tests as well. Now, why are they doing this? Because they're ruling things out. There are conditions that can cause people to be more confused that are not dementia related. And so your doctor needs to make sure that none of these things are happening, that they can kind of hone in on, okay, they don't have these things going on, so we can, you know, move in the direction of, yes, it is dementia, or maybe no, it's not. Just to give an example, a urinary tract infection, very common. In the older population, a lot of times the first sign of someone having a urinary tract infection or UTI is confusion. So when I had somebody that I saw at the nursing home and all of a sudden they were very confused, that was probably the first thing we would check for. So maybe it's not dementia, maybe it's something that's very treatable. And so they really just need to be very thorough in making sure they're testing for everything that could be contributing to those symptoms that you're noticing. You might get referrals to see specialists, and that team might include a neurologist, a psychiatrist, a psychologist, a geriatrician, and also speech, occupational, or physical therapy. We are getting involved earlier in the process, which I think is wonderful. And again, I'll go through that, why I think that's wonderful here in a little bit. But it really does take a whole team. And I think the more we can make sure that people get to the right specialist at the right time to get the right diagnosis, the better off people are going to be. And so these physicians and therapists will do their own tests and help come together to either make a diagnosis or to come up with a treatment plan. So typically when we're looking at the specialists, you're probably going to be doing more of a neurological exam. There'll be cognitive, functional, behavioral tests. Typically these tests are a little bit more lengthy than what you're going to go through with your primary care doctor. They're going to be a lot more specific. Usually primary care doctors will give kind of a screener, and I will just give this caveat. My grandmother, like I said, had only had the diagnosis for 3 months when she passed. She had been passing her screening with the primary care doctor all the way up until she got that diagnosis. And we knew that something was going on with her. So even if they are passing that simple screening test, it doesn't mean that everything's okay. You really need to listen to your gut and kind of dive a little bit deeper and advocate for that person if you feel like they need additional tests. Because we did, and thankfully we did, because she did wind up getting the diagnosis, and I think it helped a lot in her care.
Stephanie,
Yeah.
as a nurse working on the floor, something that I would often notice is kind of, I'm going to piggyback on that we
Yeah.
have family come in and they're like, oh, grandma's so confused. She's, she is doing this or that. And all my questions for them, I mean, they were totally appropriate. So I felt like a lot of times these patients they were able to accommodate the questioning, or they would kind of have the ability to, like you said, pass these tests. But the people that really knew them were like, no, this is not grandma.
Right. So I can give an example. My son, his name's Owen, and my grandma just loved him. I mean, he was the light of her life, but he was new, new to the family. And she went from being able to remember him and his name to saying, oh, how's the little guy? So, kind of covering up that she couldn't quite remember what his name was. But if you were just a person in conversation, you're like, oh, it's a term of endearment. It's like, no, she's probably doing that because she can't remember. And it went from being, oh, how's the little guy, to, oh, is his mom okay with you having him? She didn't remember that he was my son. So it was kind of a progression. But again, yeah, she was able to answer simple orientation questions, no problem. So I always listen to family because they know them best, and really thinking about what's the baseline, and are we deviating from that? Is this different from what they were able to do before? Oftentimes you will have depression screens and mood assessments, because this, there is a lot of depression, anxiety that comes with this diagnosis and these changes. Also, depression in and of itself can affect your cognitive function. So being able to say, okay, we're treating that. Are we having any improvements in the cognitive function? So that's a big part of it as well. Now, one new area that I get asked about a lot is genetic testing. So there are genes, risk genes mean that you are at a higher risk of getting Alzheimer's, versus deterministic genes, meaning you will get Alzheimer's if you have this gene. That they are currently doing a lot of research in this area. They're doing clinical trials, but at this time, it is not recommended in most cases as part of a diagnosis process. And I think that is just because there is just variability in the accuracy of these tests at this time. And I don't think that the doctors necessarily want to cause people undue stress when maybe you test positive for something, but that was a false positive. So in any case, these the genetic testing component is something that is developing, but it's not something that's routinely used right now. So you've advocated to get this diagnosis. Why? Why do we want to advocate for it? Some people might argue, well, I don't even want to know, because there's nothing you can do about it. But I would say it gives you power. It gives you the power of time. It gives you the power of knowledge. And you can't do something about a condition unless you know that it's there. So there are medical benefits to getting an earlier diagnosis. You have more treatment options. There are drugs that ease the symptoms of Alzheimer's disease. These are ones that have been around for a while. You might recognize Namenda, Aricept. Those are commonly prescribed. And basically, they do not make the part of the brain that's damaged better, but they make the rest of the brain better. And they can help with some of those symptoms. Now, the new drugs that have just recently gotten FDA approval actually change the disease progression of people living with Alzheimer's, which is huge. So these new drugs are called, and I apologize, I'm not a pharmacist, so pronouncing some of these drugs is a little bit tricky, but Aduhelm or aducanumab or lecanemab or Leqembi, Those are some of the names for them. They're down there at the bottom, so you can write it down. Because I wouldn't know how to spell it if I just heard it. But those have received accelerated approval as actual treatment for Alzheimer's disease from the FDA. They are the first therapies that demonstrate that they can remove those plaques. When we think about Alzheimer's, we think about the plaques and tangles in the brain. They can remove those plaques, which are a hallmark of Alzheimer's disease, and improve cognitive function and prevent functional decline in people living with Alzheimer's. Now, this is huge. It's wonderful. We still don't know necessarily how long it helps, but it certainly has shown that it can slow the disease process and give patients time. There are clinical trials going on for other new research in this area. So if you have a diagnosis, you can be part of that trial. You can be part of the cutting edge research in pharmacological treatments to help prevent, cure, delay Alzheimer's. So I think that's huge. And I think it's also a chance for you to improve your overall health. So you get this diagnosis, and we know that, improving nutrition, improving sleep, maintaining physical exercise, all helps maintain that brain function. So it can give you time to do that rather than waiting until the body has deteriorated to the point where you're no longer able to get out and exercise. So it does give you that time and that ability to improve your overall health, which will in turn help your brain. Oh, I don't know what that is. Okay, cost benefits. So it gives you a chance to discuss legal, financial, end-of-life decisions while the person is still able to have those coherent discussions. This not only can help save money, but I think the cost and the emotional toll that goes along with families who are having to make these decisions is huge. And so if you're able to make a decision knowing that this is what the person wanted, I think that's huge. You can also prevent hospitalization, costly inpatient testing. A lot of times people come in as an inpatient because they've had a fall, they've had a medical event that gets the ball rolling and getting them this diagnosis. But having those tests and everything done while you're in the hospital is a lot more costly than if you went to your primary care doctor and had started this process sooner. So maybe we could have prevented that fall. Maybe we could have prevented that decline, that hospitalization, if we had gotten tested sooner. And then finally, care costs and options. Caring for someone with dementia or Alzheimer's is obviously very costly. So you can look into different support systems. You can look into different options for care. You can plan ahead and, again, have that cost benefit. And then kind of going back on the emotional and social benefits, I think that, yes, the disease diagnosis of Alzheimer's will cause, a level of anxiety or depression because it's like, I don't know what the future holds. However, once you have a diagnosis, I've had a lot of patients that say, wow, I feel so much better because I know what it is. I'm not just wondering and kind of spiraling and going around and around on what could be causing these changes. What could, I've been around to 20 doctors and I don't have any answers. It's like, no, you have an answer. That, can give a lot of peace of mind. You can make your wishes known. Again, take that emotional burden off of your family. You have more access to resources like support groups, educational offerings through the Alzheimer's Association. They have tons of support programs there that if you go to their website, it's really amazing what they have. And there's a lot out there. So take advantage of it because it can really help not only the person with Alzheimer's, but also their family, because you're not navigating this alone. You have a team of doctors, of community people, everyone around you. And I think that the stigma, hopefully, and what I've experienced of getting a diagnosis is going away. More people are getting diagnosed, more people are getting diagnosed earlier. That stigma is kind of going away so that people can just really have the full benefit of that community support. And, that being said, what comes next? You're not alone. This is not something that you have to navigate alone. There's a lot of people out there to help. So number one, I think it's important to create an action plan. And going back to what I said in the very beginning, safety should be the number one goal. So of course, we want to take into consideration what the person's wishes are, but I think ultimately it comes down to safety. So number one, decluttering the home, reducing fall risks. If they need to have the stove or microwave unplugged, you could do that to help prevent fires. There are all kinds of options for personal alert buttons. So if they do have a fall, if they're still living independently, you have that kind of security blanket there that that they can push that if they need it. Going to that spatial awareness and that difficulty with that, having good lighting to make sure that they can navigate the home, and keeping commonly used items within easy reach. They're not, reaching up on the top shelf to get something all the time. This is something that's, a very sensitive subject, but if necessary, taking the car keys away and thinking about, okay, at what point are we going to move to the next level? So kind of making that decision and knowing when another placement might be needed. As part of your plan, you want to designate support persons. So who's going to help with these areas? Maybe it's one person if they can, but more than likely it's going to take a group effort. So who's going to help with the daily activities? Who's going to help with medication organization? Who's going to help with the finances? Who's going to take them to appointments? Who can provide that transportation? And if needed, get help. You can go, again, to community organizations, to the church. If they attend church, a lot of times they will have support people that can help. And so it's much easier to kind of plan ahead than it is to try to scramble at the last minute to put this list together. And again, having those difficult conversations early will help plan or prepare for the future so that you are not having to do all of this when it's down to the wire and you need to find a placement for grandma because she is not safe anymore and you need to find it now. So what does that planning look like? You're going to want to have legal discussions, financial discussions. You're going to have discussions on who's part of your care team and what your wishes are as far as end of life planning. Again, none of those are fun decisions typically to have, but they can offer so much peace of mind once you have everything kind of planned out and you don't have to worry about that anymore. So reducing kind of that anxiety. So I've mentioned several times the Alzheimer's Association resources. I've got the 24/7 helpline number listed again. They have an online community, so you can share your experiences with others who are going through the same thing. They have an online tool called ALZ Navigator that will help guide you to your next steps. So maybe, after this presentation, you're like, well, I still don't really know what my next step is. You could go there and it'll be personalized to your specific situation. And the local Alzheimer's Association Heart of America chapter, which is located just on the Kansas side, they have programs, services, all kinds of things. And it's not just on the Kansas side, they'll come over and do different things over here on the Missouri side as well. So just checking their website or giving them a call to see what is offered. And then, the last thing I like to tell people is, you can thrive with Alzheimer's. Most people don't think of that, but you absolutely can. Again, being proactive and seeking out clinical trial opportunities, I think empowers a lot of people because you feel like you're doing it for other people too. You're helping the community, you're helping your family, and just gives people a sense of purpose. For those people that maybe are farther along in the disease process, there are daily programs for specifically Alzheimer's dementia. There's also programs for people early on in the disease process through the Shepherd Center, YMCA, the Senior Center, to keep you active, keep you social, keep you around other people, because research shows that's going to help your brain as well. And then I wouldn't be doing my job if I didn't put a little plug in for what speech therapy can do. Most people, think, well, speech therapy, there's nothing wrong with my speech. Well, I like to tell people I kind of work on everything from the neck up. So that includes speech, but it also includes thinking, memory, problem solving, attention, any of those brain functions. So we can do exercises, because your brain is just like a muscle. You're going to use it or lose it. So we can help. The drugs that the doctor is going to prescribe are only going to go so far if you don't do anything else to really take care of your brain. We talk about strategies to help keep your brain, your body healthy, pillars of brain health. We talk about that. And then we also talk about adaptive interventions. So things you can do to compensate and give you that support, give your family that support, because they can come to therapy with you as well for things that maybe you didn't think of, but we've walked this journey with patients before, so we can give you some support and guidance on what might be coming next. So online resources, North Kansas City Hospital, we've really worked hard the last several years to offer a lot of dementia support through education. The National Institute on Aging has some great information, as well as the CDC. And then again, Alzheimer's Association, really just a great resource for patients. And then here is my information. If you have any questions, you can email me, call me, and I would be happy to discuss that with you. Again, I'm not a doctor, but I have worked in this field for a while, so I can probably get you to someone if you need to talk with them. And then, just thinking about therapy, I also want to mention that it is covered with a doctor's order typically by most insurance companies. So going back to that cost benefit, you can get therapy early on and really help preserve and protect your brain, as well as improving quality of life. So I am right at my time. So I want to just wrap it up there, but I really appreciate the opportunity to talk, and hopefully you got some good information.
Great information, Stephanie. You do have a couple questions here. Leslie
Sure.
wants to know, is there a relationship between Parkinson's and dementia?
So Parkinson's disease, a lot of times patients will start to show cognitive decline. I will say with Parkinson's, the most common type of dementia that we might see is the dementia with Lewy bodies. The progression of that type of dementia is a little bit different from Alzheimer's. Typically, it does progress a little bit faster. Sometimes people with Lewy body dementia have more hallucinations. You might also notice more behavioral type changes rather than just memory changes. So that's where, because the treatment of that's going to be different, getting a diagnosis can help, because you could definitely have a more individualized treatment if they know it's Lewy body dementia versus Alzheimer's dementia. But with Parkinson's, that's not to say somebody couldn't have Alzheimer's. I just more commonly see the dementia with Lewy bodies.
That's a good question. I have a question. So when you first started, you were mentioning, people are so concerned that this is one of the diagnoses they're going to get later in life.
Mm-hmm.
I am currently 42 years old, and I do these things where I'm forgetful, can't find a word. What about early onset Alzheimer's? When do we start seeing those types of things? Or when is a normal threshold of this confusion that might start? Like, what's an age?
So Alzheimer's Association will tell you anybody over the age of 65 is at increased risk. And that's anybody with a brain. Age is the number one risk factor. So early onset Alzheimer's is very rare. And again, I think it's one of those things where you really have to think about the impact on your day-to-day life. So it's going to be probably something that you cannot ignore, you cannot function, you cannot continue on with your current activities. You have to go get seen by a doctor. And it is very, very rare. I don't have the numbers in front of me, but the percentage is very low. But in those patients who are over 65, whether you have a family member with the diagnosis or not, you're going to be at an increased risk. Now, if you have that genetic component as well, if you had an immediate family member who had Alzheimer's, your risk will be higher. But age is definitely the number one, and 65 and older is kind of that threshold they give.
Good to know. Do you think that we'll find a cure?
I sure hope so. I'm really, really encouraged by the new drugs that got approved. I mean, that is huge because we were really treating the symptoms. We were not treating the disease process at all. And now we have these. And so think about what the next 10 years will bring. I'm just very hopeful. At the Walk to End Alzheimer's, you see on the left there, I have a picture from one of our walks. And you hold different colored flowers depending on your relationship. So if you're a caregiver, or if you have the disease, or if you lost somebody to Alzheimer's, and there's always this one white flower that represents the first person to survive with Alzheimer's and the first person to have that cure. And I think that's really powerful. It gives a lot of people hope. I have a lot of hope because I just feel like with the research that has already happened, there's been already so many advances in this area, from not even being able to get a diagnosis to now having 2 drugs that can potentially slow down or stop the progression. That's huge. So I'm just really excited to see what the future holds, because I think that'll be great.
That's reassuring. I like that.
Yeah.
Does anybody else have any questions? If you want to unmute, or if you want to type them in the chat box, which is at the bottom of your screen, feel free to do that. Oh, I have one more. I'm sorry.
Yeah.
The clinical trial. So say I have a family member that is experiencing these symptoms or has a diagnosis of Alzheimer's. Where do I find clinical trials available?
Yes. So you can go through the Alzheimer's Association, but KU has an Alzheimer's and Disease Center, and that's where most of the trials in our area stem from. So the KU Alzheimer's and Disease Center. And it's not just for people who have Alzheimer's. They do a lot of research on family as well. So if you have a family member who had it, you're very valuable to the research. And so I think it's a wonderful way to honor somebody maybe that you have in your life with Alzheimer's, to be part of that, part of the cure. So if you have the diagnosis, or if you have some kind of connection, or even if you have no connection whatsoever and you just want to be part of something bigger, they will, I think, take anyone, considering what they're working on currently.
That's great. All right, guys. Well, I think that does about wrap us up. Again, Stephanie Ramirez, thank you so much. She's
Of course.
Speech therapist here at North Kansas City Hospital. Again, we have the last one in our series, right?
Mm-hmm.
It is September 14th, and it is about your brain and music. It's called Music. It's a total brain workout. So please visit www.nkch.org/class, and you can find that and tons of our other great offerings that we have on that website, and you can sign up. We recorded this. This will show on the North Kansas City Hospital YouTube page. So go check that out, because there's other goodies on there. And again, Stephanie, thank you so much.
My pleasure. Thank you.
Thank you.